Good afternoon everyone and welcome to today's WorkSafe Tasmania Month webinar, Personal Safety and Property Security at Work. I'm Stephanie from WorkSafe Tasmania and also the coordinator of WorkSafe Tasmania Month. I'll also be your moderator for this afternoon's webinar. Before we get started though, I'd appreciate you taking a few moments to read over the following slide about information delivered during WorkSafe Month sessions. I'd now like to go over a few items so that you know how to participate in today's webinar. So we've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your computer screen in the upper right corner. You're likely listening in using your computer's speaker system by default. However, if you'd prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You'll also have the opportunity to submit text questions to today's presenters by typing in your questions in the question pane. In the control panel, you may submit your questions at any time during the presentation. We will collect these questions and address them during the presentation and also at the end. We are also recording webinars run during WorkSafe Tasmania Month and will progressively make them available on the WorkSafe site. And lastly, but not least, when you do leave today's webinar, you will receive a survey on the presentation, and we would certainly appreciate you providing us with your feedback on this afternoon's presentation and also your webinar experience. So it is now my pleasure to hand you over to Leonie Ridge from Tasmania Police and Samantha Forrest from Tasmanian Health Service Northwest to run this afternoon's webinar, Personal Safety and Property Security at Work. Welcome Leonie, welcome Sam.
Thanks Steph, and first off speaking will be me, Sam Forrest. So as you can see on the screen, I'm the Work Health and Safety Consultant with THS in the Northwest region. And first slide that we wanted to talk about was a bit around the identified issues and the reasons for why this program was birthed in the first place. So when I came on board into the organisation, I was seeing a bit of a disparity between what was actually coming through in the safety and incident reports and what staff were telling me. So we'd had some theft of personal property on site. A lot of that had been from items left in public view. So we had a lot of workers that were leaving their handbags and valuables out where members of the public would be walking through our hospitals or community health centres. We'd also, unfortunately, noticed quite an increase in aggression towards healthcare workers, some of that partly to drug and alcohol related issues, but in general there's a decreased tolerance and patience in the community, unfortunately, towards healthcare workers and frustrations towards what they expect service-wise from the hospital and turnaround times when they come to hospital. Nobody likes having to sit for a long time if you're sick, and that can kick off with aggression incidents towards our workers. The most concerning for me was the low level of security awareness with the workers. We had a lot of workers who were completely desensitised towards risk because they were overexposed to it on a daily basis when they were coming to work, and they also had a very lowered perception of what risk actually was. They didn't see the issues that could potentially create a security problem or an aggression incident kicking off. And then on top of all of that, we had, due to the location of where we work, there were a lot of remote or isolated workers. So we had a lot of healthcare workers that go out into the community and provide care, and they'd also noticed an increase in aggression, and we were quite concerned about their security while they were out and about. So having a look at all this, I started to think, what could we do about investigating what to do about the issue. So I had a look at what we had. We had site security audits done both internally by the Work Health and Safety unit here and also externally by an external security provider, the security guards that we have on site. So I looked through that information and tried to gain a picture of what was going on. I also consulted with workers, and during the consultation with workers it became very apparent that what they were telling me that they were doing with regards to their personal security at work was not in actual fact what was happening and what I was witnessing with my very own eyes around the organisation. I would meet with them in work health and safety meetings, in tea room talks, and I'd also go through and have a look at what we actually had recorded on our electronic incident investigation system. I also spoke with the security providers at great length and asked them, what is it that you are actually seeing while you're doing your patrols around the hospital? What are your concerns? And I also went in and had a look at some best practice research. I looked at what other hospitals were doing. There was lots of information around lockdown, but there wasn't a lot about how do you change workers' attitudes towards their personal security and organisational security. So in the end, we decided to do something a little bit radical and to cut through the crap, so to speak, with doing a secret audit.
Good afternoon, my name's Leonie Ridge. I'm from Northwest Community Policing, and we met with the hospital staff and talked about some of the issues that had occurred, and out of that the secret audit process came to be. What that actually meant was that I dressed in non-police clothing, just normal clothes, moved through both the Mersey Hospital and the Northwest Regional Hospital, and basically just had a look at where I could access, what secure areas were actually secure or otherwise, what property was visible, what potential articles of weapons or other devices could be sourced by would-be offenders if they were in an aggressive state, and essentially just to see how it was to a member of the public who most staff wouldn't have recognised as a police officer. So both sites, the audit was conducted over an extended period on a general work day. I moved throughout all areas and the findings were then collated into a report, and that report then formed the basis for our training program. One of the really interesting things I found was that there was a large amount of personal belongings in both workplaces excuse me, that were unsecured or not in a locked device. There was lots of IT devices that were also left in the workplace, which are often items that would-be offenders find very tempting to steal or remove. There was also a clear ability to tailgate through secure doors with other staff by just hanging in the area of the secure doorway. Staff would then provide access into it. There was a large amount of signage in both campuses referring to areas that should be locked or doors that should be kept closed, and often this was in contrast to how they actually were found to be. So a door might have a sign on it saying this door is to remain locked at all times, but the door would in fact be open, which, thinking as a would-be offender, provided an invitation or implied that there was something in there that the public shouldn't have access to, perhaps. I also found that staff were, generally really helpful and friendly, which is great. However, if I was nearby to a secure area and a staff member asked me, do I want to go in there, and I replied yes, I found that they'll then let me into the secure area, which is in fact quite a concern. Staff are always generally very task-focused as well, so they weren't always aware of an unidentified person moving through their workplace, and they were often very focused on what they were doing, and their peripheral attention didn't allow to take in or question perhaps what an unknown person was doing moving through their workplace. I noticed a degree or a large amount of items that potentially could become weapons, such as sharps and scissors and, for example, knives in a kitchen area and things like that, and had some concerns about if I was seeing them, then perhaps members of the public could as well. One of the other significant issues that we did identify was that the types of questions that staff might use to perhaps challenge my movements in their workplace or to check what I was up to often lacked appropriate structure that would give them the information they're after. For example, if they asked me, was I okay or was I right, all I had to answer was yes. And then that question didn't lead on to anything that they needed to qualify. So perhaps when they should have said, who are you here to see, or what department are you looking for, that then gives a direction to what the information I would need to provide. And quite often that wasn't the structure of how I was challenged or how I was approached by staff members. So that was another thing that we identified as perhaps was an issue. Another thing that I did also note is that staff, being generally friendly, were often perhaps providing information about other persons in the workplace that wasn't appropriate to be shared with me. So we collated all that information and then had the issue of what to do from here. I'll hand over to you, Sam.
Okay, so then we started to sit down together and look at some of the solutions now that we had the information. So one of the first things that came up was around infrastructure changes and upgrades. So automatically putting in for new CCTV coverage, new duress alarms in areas, new security screens over reception areas where people could jump over a desk, new desks that were higher and make it harder for people to jump over, looking at doors so that people would be blocked off from areas that they could get into before, and also making more areas swipe card access. We also then had to review and look at our policies and procedures that we had in place. We had a Code Black training policy in place, and Code Black is our physical takedown restraint policy in place. So we made some alterations to that. We also rewrote and redid a working in community environments policy, or for your organisation, something around a remote worker policy would be an equivalent thing. And we also updated our security policies and procedures to make sure that we had all of this new information embedded into it. The next thing that we looked at was the de-escalation training. So when our workers who are involved in a Code Black would be part of a team, they would do 2 days of training. Day one of that training was all around de-escalation and learning how to ask those questions that Leonie has just mentioned, and also how to you have the right body stance and tone when speaking to somebody who might either be already aggressive or about to kick off an aggressive incident. So we've now opened up the day one of the Code Black training. That is now opened up, especially targeting to frontline people. And those frontline people we've expanded out to include people like receptionists, because we were finding that they were copying a lot of aggression and security issues. The uptake on the de-escalation training has been phenomenal. We've now, like all of our frontline staff have been going through, and we're now getting just general staff members who feel that they want to have these skills coming on board with that training. The technology that we've done is we've now included security audits onto iPads. So we have mobile ability to go around and perform security audits in any department. And the last one of the solution was the awareness training for personal security at work. And I'll hand over to Leonie.
Okay, so the training that we decided to deliver was going to cover several main areas that we'd found through our secret audit process. We wanted it to be specific to the workplace that we're delivering it to. So prior to the training being delivered, we would get the team leader there to reflect on any issues, whether they were incidents or structural issues with the building or the workplace, so that we had those in mind when we were delivering it. We would also deliver it in-house, so in the workplace, whatever the location, whether it be the West Coast or King Island, Smithton, to the actual teams themselves. And this was a really good point to work with because it meant that teams were in their comfort zone and they were in their own workplace, and we found that was really conducive to teams being really open and sharing what their concerns were as well. We opted for a fairly informal delivery, and we encouraged that the workers would participate and ask questions and provide feedback as we went. However, the training sessions were also short and sharp because we had a fairly distinct message and we wanted to stick to that. We used and encouraged the use of scenario discussions so that relevant concerns and possible solutions that the actual workers have thought of themselves because it is their own workplace were then often brought up. These ideas and solutions would then be referred back to the Work Health and Safety Unit, and that process has been really, really useful to create change and to get things done. We're really keen on there being a clear workplace link to Tasmania Police, and while all of the participants in the training sessions knew that they could contact me at Western Community Policing, it was really important that we had some strong linkages formed with the communities that they were working with. So, for example, if they're in Rosebery or Smithton, that they had some idea of who their local police were, how they are best situated to contact them, and to get some relationships formed there, because if you have a relationship with someone or you can put a name to a face, you're more likely to work more closely with them or perhaps refer information or concerns through to them more readily. And this is a really important thing that we hope has been a positive outcome of the training. The actual training sessions had been scheduled into the annual training program for the organisation, which provided me with some structure because I was the main person delivering with them, and also let workers know when they were available and they had access to them at all times. And really importantly, the training was available to all staff, so there would always be a range of participants at the training, which in itself was really interesting because it allowed some really good discussions between all people in the workplace as well. The matters that we covered in the sessions, as you can see on the screen, premises, security, personal, workplace issues, and community workers and general matters. And what those actually looked like were, for premises security, obviously, your doors, your windows, your vehicles and all your physical structures, how secure were they? What were the processes that the workers were using to ensure that they were secure? Was there CCTV in the workplace? Was it facing the right direction for the current use of the building? Was it supplied by a professional service or were staff using it, and were they the ones who needed to know how to access it or change it or problem solve if there were issues? That's something that as police we notice can be a real issue, is when there is an incident, who in the workplace can provide us with the footage or the details. And so that was something really important to come out of it as well. Also the compliance around security procedures. Is that checked? Is it something that's covered off when new staff complete their induction process? And is it something that is able to be complied with, or does it not work? Most premises have key or card security, and we discussed how those logs are maintained, the key register, and how all of that process is worked. A range of premises, so there's also a range of maintenance that happens, and external lighting and signage and repairs that, when you go through a whole range of buildings for an organisation in a large area of Tasmania, you'll obviously come across a range of that, and just looking and getting staff aware that they have a responsibility to report or to become aware of something, and not always someone else will report that a light isn't working or a door is broken, and that actually rests with them to ensure that that information is passed on. We discuss things like landscaping and creating hiding places or ensuring that there is good visibility for access points to the building and around car parks and other areas. So yeah, entry points were particularly interesting, and ensuring that the lighting was sufficient for their use. And the regular testing of all security measures and duress systems. Not all staff were always aware of what those systems were. Some referred to knowing that there was a button in a drawer somewhere that we could push, but didn't really know who that button alerted or what happened if it was pushed. So those sorts of things were really good to actually get the staff to understand what happens and what circumstances they should push it, and just to feel confident in the use of their actual security that's in their workplace. Another big thing that we noticed throughout the check, that staff just were perhaps a little bit too lax in their security around their own belongings, and making sure that they understood their need to use the security storage places that were provided for them. And that leads on to the personal items. Everyone seems to have a variety of IT devices these days, and the bags and connections that come with them. They're also really easy items to steal and readily can be converted to cash by an offender. So the workplace is often subject to those sorts of items being stolen, so just increasing some awareness about how they are, I guess, storing them, and what keypad locks and other security considerations they're using, and obviously handbags and cash and other items of value being left in offices or in desks that aren't secure was also something that we discussed around this part of the presentation. Obviously, work-related items such as keys and cards and swipes and all work-related paperwork, it's the worker's obligation to ensure that they maintain to an appropriate security level. And in some workplaces, due to the structure or the environment of the office, they were often visible or could have been accessed by members of the public, and that's something that we're really working to having a much greater awareness around. Community nursing equipment is often believed by perhaps people in the community to contain lots of interesting items, perhaps for someone who may have a drug misuse issue or something similar, and just raising awareness around how that sort of property is stored in work vehicles as well. Really pleasing to note through the audits that medical stores and those sorts of considerations didn't appear to be a problem. However, while social media seems to be in most areas of people's lives, that was something that perhaps staff hadn't thought a lot about, and the need to be concerned about maintaining a reputation and the reputation of the organisation itself through use of social media by people in the workplace is something that we also discussed. Car parks are also an issue for health workers, because often they work unusual hours and they're coming and going in the middle of the night, or when there's perhaps greater incidence of people not being visible to others, so there's a higher risk perhaps of issues occurring. So we discussed some strategies for those, but also if people are observing people, whatever the time of the day, in the land or premises that their hospital or their community centre sits on, how they should perhaps report that more effectively, reporting it to their workplace, or if they're even more concerned, reporting it to police, and how they might go about doing that. And an interesting thing I found when walking through all the workplaces, that some people don't log off their workstations, and that could be a significant issue if someone wants to access them and to use them for inappropriate purposes as well. Not all staff were always completely comfortable in their knowledge of workplace safety plans and procedures, so that's obviously something that the teams could go and work directly on. And perhaps one of the things we try to raise awareness around is that what items can potentially become used as a weapon. So we spoke about kitchens before with knives, but in examination rooms, what items are in there that could potentially be a weapon? Sharp storage containers. Their hospitals have very large ones, and often they're visible to the public. And so obviously, how can we perhaps make that sort of storage item a little bit less obvious? And other considerations around workplaces that have needle exchange programs as well was something that staff were very keen to discuss their concerns around. The second last area that we talk about in the presentations is risks and assessments being completed around mental health patients or other patients, environmental hazards for people going out into the community, and that could be anything from a dog through to other family members in clients' homes, or articles, in people's property, or just general risks, whether it be an animal strike in a vehicle while they're travelling down a road in the middle of Tasmania somewhere where there's no phone coverage. So just looking at all of those sorts of environmental hazards and how they record and look at their daily schedules to make sure that those risks are lower and the assessment of them is thorough. Looked at possible use of more technology, so what phones could better provide better security for them, and also what phones could do as far as other apps and other programs that might make their workplace more efficient and safer. And last but not least, we just discussed some general things, and that might be the use of agency staff and what's their induction process like in that workplace. What ideas do they have for the use of verbal and non-verbal conflict resolution techniques, and that definitely varies between most workers, and looking at what programs they're engaged in to help them with those. We really discuss at length how they can best contact and get help, whether it be police after hours or other ways to problem solve. So it might be that they work with their local police station to look at some other issues to make processes safer. And last but not least, we look at how they're making sure that they record their concerns in the workplace so that if they don't have to come back to work on Monday, someone else knows that information that they've become aware of. We also make sure that people refer to Tasmania Police website, where there's lots of publications and pamphlets there around safety and security measures and other information. So yeah, we try and get through that fairly promptly and then allow a time at the end of it for questions and discussion. And as you can see from the photo on the screen, we've had the sessions in everything from canteens through to wards to theatre education rooms. So yeah, it's happened in a variety of processes.
Okay, so Sam back here again. When we were looking at the outcomes as well, one of the main things that I wanted to see as a work health and safety professional was a shift in the culture. The culture that we had was fairly negative towards this whole topic, and during the last 12 months especially, we've had a dramatic increase in security hazard reporting. So a hazard reporting is what is called a lead indicator, and shows that people are being proactive and trying to do something about a workplace risk before it becomes an issue or there's been an incident. So this has been a really quite a clear indicator for us that the training is working and that we're seeing the numbers really increase. To the point that now we've put in on this cultural shift and on the hazard reporting, that this is now part of our organisation's, one of the KPIs that we use to measure safety culture success in the organisation, and we now report that every 12 months to the Department of Premier and Cabinet for review. So a bit more on the outcomes. When we're looking at it, we get the workers to do a self-assessment post-training, so looking at reflective learnings for the workers, where they can actually stop and have a think about what have their actions been in the past, have they allowed some of these things to occur, and what they can, have they been challenged themselves during the training to change their practices. And it identifies the knowledge gaps that they have, and instead of making them feel that they have done the wrong thing, we've found that it's actually motivated them and made them motivated learners and wanting to learn how to improve things in their area. They had no idea, some of them, how lax they were in their practices, and when confronted with the fact that Leonie had actually gone in and been able to do these things, like I said, it cut through straight to the point where they can't deny that this has been occurring. Another benefit from it all has been worker-driven training opportunities within the organisation. So the workers themselves have driven the change with the de-escalation training. So they themselves requested that they wanted to be involved with the day one of the Code Black training, that they needed the skills, they wanted to help change their workplace. So once again, another indicator of a positive safety culture occurring. To the point where we've actually had to train the trainers, we've had to get more trainers on board to cope with the amount of people that want to have this training done. And performance review with anything, evaluation is important. So when people go to these sessions, we have feedback evaluation forms. And people have been pretty honest and open with the feedback forms. Most of them really enjoy, and it immediately engages them when they hear about how Leonie came about with the information. And straight away, once you catch their attention, they're hooked. So we've had some really good post-training assessment forms come back, and with these feedback forms we use these to help us streamline the program and make changes. One thing that Leonie mentioned too was as pleasing for me is that the amount of hazards and issues that people bring up, once they're in a discussion forum, it prompts them. So things that they might have noticed but never done anything about, we're seeing those things being raised and recorded properly and documented through the organisation, and some positive outcomes happening from that with definite changes. So next page. We've already talked a bit about the marked increase in workers reporting security hazards. We've also been able to, because of the increase, sorry, the slide's not going. There we are. We've talked a bit about the marked increase in workers reporting the security hazards. Part of what we've also found when we were doing the training is that a lot of workers did not know how to use our own reporting system. So that was a gap that we didn't realise and had hindered some people in reporting. So especially key area groups like cleaners and maintenance people who are out and about all the time throughout the organisation, they hadn't been shown how to use the system, so they've been trained now. Because of the dramatic increase in reporting of security hazards and the uptake with the training, it's given me in my area the say to go to management and say, look, this is a definite need that we have here. This many workers have raised this. We've got this many incidents coming through and hazards identified in this area. So as a direct result of work input and the hazard reporting, we've been able to do some fairly major upgrades to security systems and infrastructure, which probably wouldn't have been possible if I didn't have the data behind me to show that. There's been a greater worker awareness and ownership of organisational and personal security work, which is really pleasing. So people are actually taking it on board and making it their own. And we've seen, not just at the worker level, but an organisational shift towards improving security. So we've got changes in our practices, both through policies and procedures, but making part of this training part of our everyday business now, which has been a really a nice outcome to the organisation.
The program itself, given that it's quite short and not onerous, and is also extremely low cost given what's required to perform the presentations, we believe that the workplace application is quite significant in retail, the retail area, local government, education, pharmacies are another place, and the aged or community care cohort of our community would also potentially really benefit from a similar program. The risks are very similar. The human behaviour component itself is also similar. So we believe that there'll be a really broad application of this program, but with very few modifications. So that was a really pleasing outcome. That's something that we found to work for us, could also apply to lots of other organisations. So in closing, we've got up on the screen there some of the resources. If you're interested in doing the security audit side of things on the iPads, the great resource there to use is the iAuditor tool under safetyculture.com, which is on the screen. Obviously the other resource is Tasmania Police, and if you've got a work health and safety or a HR manager, link them in to what you've heard today. We're more than happy to take phone calls or communicate with any organisation that would like some help or know where can we get started. So thank you to everybody for listening to us today. And Steph, did you want to ask the group if there are any questions?
Certainly. So thank you very much, Leonie and Samantha. As they both said, if anyone does have any questions that they would like to submit to either Leonie or Samantha or both, please do type your questions into the question pane in the control panel on the right-hand side. And while any questions are coming through, I'll just remind everyone that we do have further webinars running during WorkSafe Tasmania month right up until the 30th of October. So next Friday is the last day of WorkSafe month. Do head to the do head to the WorkSafe TAS website. Do have a look at the program of events, or jump straight to the events calendar to see what else we do have running. Tomorrow we have the Hobart Health and Safety Reps Conference at Rest Point. So that's certainly an annual event that we have run for the last 7 years now during WorkSafe Tasmania month. So again, do head to the website, have a look at what else we are running.
Well, it looks like we're in the clear.
It looks like it. It looks like it. So I'll just do a wrap up. But if anyone does have any questions while I'm continuing to close the webinar, please do type them in. We've still got a few moments before the actual close time.
Thanks for that, Stephanie, and thanks to the other participants who attended today.
No, hold on. A question that's come through. Sorry. Yes, so just in regards, not a specific question for either you or for sorry, Leonie or Sam, but yes, we are recording the webinars, and we'll progressively make them available on the WorkSafe Tasmania site. I say progressively because we will need to make them accessible for the website. So do bear with us while we do make all the webinars accessible, but we will make them available on the WorkSafe Tas website sometime after WorkSafe month.
Thank you.
All right, so
Thanks,
that's okay. So on behalf of WorkSafe Tasmania and our presenters, Leonie Reach from Tasmania Police and Samantha Forrest from Tasmanian Health Service Northwest Region, we both thank them this afternoon for their webinar, Personal Safety and Property Security at Work. So thank you everyone for joining us today, and have a great rest of the day, and I hope it's a safe and healthy one too. Thank you.